I wanted to talk about the expectations for what happens to patients after a UFE procedure. The afternoon and evening following a UFE procedure, the patient is in bed or on the couch and there is no activity for that afternoon and evening. One of the things that's helpful in the recovery while the patient is in bed or on the couch is for her to apply a heating pad directly to the pelvis. A heating pad is helpful for the pain that's experienced after the procedure. Now, she'll also be on medication. She'll take Motrin, which is a strong anti-inflammatory medication at the prescription dose, which is 800 milligrams, every 6 hours for the next 5 days. She'll also be on a narcotic as needed, usually only for the next 2 days, every 2 to 4 hours as needed. She'll also be on a stool softener, and she'll have a medication for nausea in case she gets nauseous. So that first day, the patient is in bed, on the couch, trying to sleep as much as possible, because obviously if the patient is asleep, she's not feeling any pain. And the first afternoon and evening is when most of the pain and discomfort is felt. Each day afterwards is getting better and better and better. So the typical recovery is about 5 to 7 days, with that first day or two being the most pain and discomfort. And so the key is getting the patient through the next 24 to 48 hours with medication and these simple instructions. The day after the procedure, we encourage the patient to walk around as much as possible. We instruct them first to start with a chair because they've been in bed and they've been lying down for a long period of time. So we start with a chair and then walk around the bedroom as much as possible, walk around the house as much as possible. We want the patient on the day after the procedure to ambulate as much as possible. And then when they get tired, go back to bed or couch. They can have whatever liquids they want, starting the afternoon and evening of the procedure. But the following morning, we want to push fluids. As much fluid as the patient will consume, the better. And the best fluids are Powerade, Gatorade, or broth, soups that have salts, electrolytes in them, but water is even fine. We want as much fluid as possible and as much ambulation as possible. The key 48 to 72 hours after the procedure will be bowels. One of the medicines that we give, the narcotic, while it is a very strong, powerful pain reliever, it also is a powerful constipator. So that's why we encourage the patient to use the narcotic for the first day or two to get through the roughest part of the recovery, but as soon as they don't need the narcotic, don't use it anymore, because eventually if you use enough of the narcotic, the pain of the procedure is replaced by the pain of not being able to move your bowels. And then we're trying to stimulate the bowels to move, whether it's naturally through black coffee, prune juice, smooth move tea, or stepping it up to an oral laxative or even magnesium citrate, which is the most powerful way to try to get a bowel movement.